Today, I'm authorizing a new screening program for testosterone deficiency for our service members, ensuring you have the right testosterone levels to operate at your absolute best. Because it's well established science that as we age, testosterone levels often naturally drop. Under the supervision of our world-class medical professionals, warfighters age 30 and older are going to be tested annually as part of their periodic health assessment.
So, as yesterday, Defense Secretary Pete Hegseth announced his plans to test U.S. military members' testosterone levels, and he recommended hormone therapy to those with low levels. So, as a physician who works in critical care, I'm interested in hearing your opinion on the move and how realistically it would play out.
Yeah, sure. That's a big topic. So let me give you a little overview. So testosterone's been in the news for like the last 20 years, right? Low T, you see the commercials, they hear all the advertisements about typically targeting symptomatic individuals, symptomatic males, and I'll tell you why males in a second, because I think if correct me if I'm wrong, this includes female recruits as well. So I'm going to talk about the males because that's where all the data and the conversations at. So, low testosterone with symptoms, symptoms being, once you get over the age of 30 and 40, your testosterone level normally drops. That's just a normal part of male life. But sometimes you have symptoms of sleep disturbances, libido problem, erectile dysfunction, low muscle mass, fatigue. And then you go to a physician, and the physician typically orders, if you're a male, a testosterone level to screen you for what's known as hypogonadism, which is symptomatic low testosterone. And then with counseling, the discussion between the physician and the patient is usually, should I get treated for that or not? So that's the medicine behind it. This is a surprising advent. They're targeting recruits or military personnel over the age of 30, both males and females, and just doing a screening test devoid of whether you have symptoms or not. So that's really goes against guidelines. The American Endocrine Society, I believe, and some other societies have guidelines in place on when you do proper screening and treatment. So that's a non-guideline recommendation. Um, uh, the caveat to that is, again, we have to put this in perspective. These are not typical American individuals. These are people in the military. And military personnel typically have testing sometimes above and beyond the general population because of what their tasks are. They're supposed to be combat ready. Some of them work in particular situations like, fighter pilots or individuals that work in aviation where they need to have extra testing on top of the general population. So you could make an argument this is a different population you're testing that may be they may be asymptomatic, but having a low testosterone level could maybe potentially put them and uh, their co-military people at risk for not being combat ready. There's no data on this. I think the only positive that I see for this, and again, I'm going to be really specific about this, um, is it could potentially pick up individuals who do have hypogonadism that do require treatment. I think as it rolls out now, I think the recommendation is for voluntary treatment, which I think is also something that should always be, it should not be forced upon them. And I think as a physician, it's a little difficult to, recommend a screening test on individuals that don't have symptoms, but it's in a particular population that may be at risk for, being injured or killed in combat, or having their co-combatants being injured during combat if they have a low testosterone and they don't realize it. I think I'm hoping if they do in fact do this, that they put some data behind it in terms of this is how many people I picked up, this is how many individuals I treated, this is some of the things I avoided in terms of health risks. Now, unfortunately, some of these health risks we're talking about with low testosterone and symptomatic patients can take decades to come out. Like men can develop osteoporosis because of low testosterone. They can develop cognitive dysfunction. They can develop more obesity, more hypertension. But these are long-term things, not short-term things that if you're in the military for 4 or 5 years, you may not even see those things. Now that's in men. Now, if you happen to be a female recruit, women notoriously have a tenfold decreased testosterone level. And testosterone therapy in women is really in question. And it's actually off-label for FDA use. It's not approved for women. And the reason for that is well, obviously, it's the main sex hormone for men. It's not for women, which is why women have a lower level. And I'm really skeptical about starting to treat a population, women in particular, with testosterone therapy when there's really been no studies, no long-term outcomes, no even what's the benefit. I see downside. Now, the downside of testosterone therapy is it can actually, could lead to blood clots, could lead to elevated red blood cell counts, which could lead to strokes and heart attacks. It's not all benign. It's not all, it's not all roses. And that's in symptomatic men with low testosterone. How about women who are supposed to have low testosterone levels and you're doing all these negative things by treating them? So I think it's a little unfocused to do screening with that includes women for this.
They're testing, military personnel 30 and above. Is there any scientific baseline with that selection of 30?
Well, as you get older, right? Once you hit above 20 and especially the age 30 and above, your testosterone level normally decreases. That's just normal physiology. But so if you're going to take a look at a patient population that you're going to look for low testosterone, that's probably the patient population you want to look at 30 and above. But I throw symptoms in there again because symptoms should really be driving the diagnosis and the treatment. Let's say my testosterone level is 50, which is really, really, really low. But I'm asymptomatic, I'm living a good lifestyle, I have no blood pressure, no sleep-related breathing. Are you really going to treat that? Probably not. So that's why the symptoms and the level go hand in hand. And I think, yes, over the age of 30, it makes no sense to measure someone in their 20s. You want to push it back again, how old you're in the military for, how long you're in the military for. I think the age is okay, but disconnecting it from symptoms may not be.
What concerns you most if these people who are otherwise healthy service members were to begin taking testosterone?
My big concern is, although it's voluntary, you're in the military, you found out that you have a low testosterone level, the medical officer knows you have less low testosterone level. Does your commander know that? And the people in your infantry or division know that? So there's going to be peer pressure or some type of external pressure to treat something that doesn't need to be treated. That's my big concern with this. I think screening populations, and again, military people, you want to say, okay, it's a special population, maybe you want to screen them. I think that's okay. But it's the particular situation they're in now. Is it really voluntary treatment or not? I mean, at the end of the day, it's probably going to turn out a lot more of these people are probably going to be treated than not. And maybe more so that don't even have symptoms. They're just told they have a low testosterone level, the psychology behind that. So that's my big, big, big concern.
And can you tell me how testosterone levels actually correlate with, performance capabilities?
Yeah, that's a tough one because it's going to be hard to find good data to show that there's a direct correlation. So in other words, you can have a male. I'm going to use men because I don't think women should be treated. So I don't mean be sexist, but so you can have a male who has a testosterone level of 1,000, which is high, and a male that has a testosterone level of 450, and the 450 male outperforms the male with 1,000. It's not just about a testosterone level. It's about the individual and whether that individual is healthy, fit. So there's a real loose correlation between the two. And there's no direct relationship at all. There is in men with symptomatic low testosterone levels, a correlation with treating with testosterone therapy with improving mood, improving libido, improving erectile dysfunction, and improving muscle mass. None of those have to do with performance.
So, this initiative is being framed by leadership as one that will restore and optimize natural capabilities. But in medicine, where is that line between treating a deficiency and performance enhancement?
Yeah, that's tricky because, you can make an argument that those individuals have lowish testosterone with no symptoms. This is really performance enhancement in a way. But again, I want to take a little edge off of that a little bit, because the typical doses to treat low testosterone should not put you in the range of like anabolic steroid abuse. Get your levels 2,000, 3,000. So abuse is a little term I want to be careful to say. You'll supplement probably a little more physiologic than would normally be, but I wouldn't think in the super physiologic range, or that should be, hopefully. Hopefully, if they're monitored correctly and they have the levels correctly, they're not going to be overdosed and put in that range of performance enhancement, which would be a complete disaster for the poor military recruit.
I want to talk about this just one last time about women. The announcement doesn't, mention women, but what are the implications here for female service members?
Well, like I mentioned before, it's females have 10 times less testosterone level than men. And actually, I'm glad you brought that up because um, women in the military perform the same as men in military, and their testosterone levels are 10 times less than men. That should tell you everything you need to know about testosterone levels and performance, right? That's the first thing. Second thing is that my expectation is every single female recruit should have a low testosterone level. And what is really low for a woman? 0 is low. Okay, but what does that mean? I don't know how to translate that medically into something meaningful. The only thing, and I'll mention this again, the only thing that's meaningful is if you have a woman, for whatever reason, complains of, I have a low libido, I have no sex drive, I have, and it's impacting me, then maybe. And then what's the level you treat at? That's an unknown. But other than that, that's just pure, you're making data up and just unnecessary testing on individuals.
Thank you so much, Dr. Cassier.